with Dr. Nario of Biointegrative Health Center. Thanks so much for being with us, Doctor.
Hi, Steve. Thank you for having me. Always a pleasure.
Okay, I love to talk about glutathione. Glutathione, I know we need it, but can you first just tell us what does glutathione do? I know you would be here for days telling us all the things that glutathione does, but just briefly tell us, what does it do? Glutathione. Why do we need it?
Well, Steve, every time we hear glutathione, it's always about free radicals. It's a potent antioxidant. That's always I want my patients to think about. And it's composed of three peptides. One is cysteine, glycine, and glutamic acid. So if you're drinking, for example, your protein drink, if you have these three, for sure your body will synthesize or create its own glutathione because it's created in your own liver. And again, when you think of all these nutrients that are made by your body, as we age, we decrease in the creation of such because of course, wear and tear of the body. And the liver is the primary organ where it gets created. So we always hear about it's a potent antioxidant, but it's also a potent detoxifier. Because when I mentioned to you about the liver uses this to clean up the system also faster and better.
So did you said those are three amino acids, right? So if we supplemented with those three amino acids, our body would create the glutathione. Is that right?
Yes, that's correct. So the thing here is, Steve, you have to remember that they will be synthesized by organs, which is specifically the liver. So we need to make sure that our liver is working well, so that it would know how to put them all together to create glutathione.
Right. And okay. So I got another question that I'll get to in a minute about how to other ways to take it, but what are some of the other benefits?
Right. Well, benefits really it comes from the theme of antioxidation. When you talk about antioxidation, it actually lowers down what we call the free radicals or reactive oxygen species. And thus, now when this happens, free radicals, you have to remember they're like dynamite, destroying every organ that out there. If these are like we call electrons that are unstable, and if you let them roam free, you're going to destroy all your tissues and your organs. That's why anti-aging is one of the best effect of glutathione. And people think about always when they hear glutathione, aesthetics, the skin, how glowing it is, and even the blood flow is improved. That's why you have youthful, radiant look when people think about glutathione. And you would hear about the anti-cancer effects, the antiviral effects. This is now focusing on the immune system, lowering down the free radicals that the immune system has in terms of load. And that's why the immune system can now work better, killing infections. And you would hear this also being used in alcoholism, like the fatty liver, I'm sorry, the non alcoholic fatty liver of alcoholism, and even exercise induced fatigue. I have a lot of athletes who actually uses this to increase muscle strength. And also Parkinson's is a very beneficial condition where glutathione has a big role.
Okay, so I know that glutathione it decreases as we age, right?
That is correct. It actually decreases 1% per year as we age.
Wow, that adds up.
Mhm.
So what is the best way for us to take glutathione? I know that it doesn't really work well if we try to ingest it orally, right?
That is
So
correct.
to get glutathione directly, what are our options?
Well, Steve, you're correct. But the thing here is, I have to really emphasize on oral because that's the most available, for example, and the easiest way to take in glutathione. I'm not disregarding oral because it's different when you're talking about capsules or tablets. But if you're talking about a liposomal form of glutathione, it's not 100%, but it's definitely better compared to just specifically tablets or capsules. Liposomal is actually more of a fat-based carrier where they put the molecule of glutathione in between or inside. Then when it interacts with fat, it absorbs better and faster. So if you don't like glutathione orally, there's also what we call NAC. N-acetylcysteine is the precursor of glutathione. Again, how much will convert to glutathione? We don't know. Just because the body is again wear and tear. The liver can do it, maybe, maybe not. But NAC can also contribute to the glutathione storage that we have. But the best ones really would be number one, topical, something that you rub on the skin.
Hmm.
So there are products out there that I've been using with my patients now. It's just a little pricier than normal, but it actually works and has increased the number higher than an oral form of glutathione. And of course, in our practice, we use IV. IV is also something that is very important. Even cancer, Parkinson's, the chronic illness that I see every day here, that's the one that benefits well with glutathione. And intramuscular injection, I wouldn't suggest that. I have a lot of patients who reacted to it because it's a little painful. So IV and topical maybe are the best ones for me.
Right. And you also do a push, right? So after somebody gets a vitamin bag, you can do a push and you just push it in
Yes.
right in that same space.
Right. So that's IV also.
And the liposomal you mentioned, how much of that do you think actually is used by the body? If because I know it's hard, but
Mhm.
is it 25% that you think gets absorbed or?
With liposomal, when you compare it to IV form, so let's say IV form is 100%, right? Because it's directly to the veins. So they were saying the studies are actually showing up around 50, 60, sure, tops, but almost 50, like flipping a coin. Let me give you an example on how high an oral is, maybe 10, 20%. So that's really going to be like putting your money better in the right places when you're talking about liposomal.
Wow, that's pretty good, 50%. And that's a liquid, right?
It's a liquid most of the time. And the thing here, again, you have to remember this is gut related absorption. If you have gut damage, for example, like somebody who has Crohn's or ulcerative colitis, you have to consider that also. And leaky gut. That's why it's so unstable when you're talking about oral forms of vitamin intake, just because you don't know what the terrain is. We don't have an idea every day on how it looks like in there.
Hmm. Okay, everybody, if you have questions about glutathione, please put them in the comment section. We'll try to get back to you. I see those, I'll point them out to the doctor and maybe he can answer those for you. So that's Dr. Nario at Biointegrative Health Center there in Reno, Nevada. You can find out all the things that they do online. Thanks for being with us, Doctor.
Thank you, Steve. As we all know, knowledge is power, and thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.